Now let's learn the differential diagnosis of increased bilirubin, which is called a jaundice. Mainly two type of bilirubin is present. First is conjugated and second is unconjugated. If conjugated bilirubin is elevated, then it can be of congenital or acquired. In the congenital, there are two syndromes associated with increased conjugated bilirubin, and they are Dubin-Johnson syndrome and Rotor syndrome. In acquired conjugated hyperbilirubinemia, there are several causes. First is intrahepatic pathology. They are hepatocellular, cholestatic, infiltrative, sepsis, etiologies, and drugs and toxins. Here, AST and ALT enzymes are markedly elevated than ALP and GGT. And the second etiology is extrahepatic cholestasis. It can be due to tumor, pancreatitis, stricture, choledocholithiasis. Here, ALP and GGT are markedly elevated than AST and ALT. Now let's see unconjugated bilirubin. The etiology may be congenital or acquired. There are two syndromes associated with congenital unconjugated hyperbilirubinemia, and they are Crigler-Najjar syndrome and Gilbert syndrome. An acquired unconjugated hyperbilirubinemia may be due to hemolysis or due to certain drug ingestion.